This is Dr. Anderson with North Texas Plastic Surgery, and today we're going to talk about what happens to your skin after weight loss. So this topic is not always the most straightforward because everybody's skin responds a little bit differently considering where they're starting, where they're ending up, how old they are, and a lot of different factors. But I'm going to go through the basics so you can have an idea of some things to expect, and then whether or not you kind of go down route A or route B, how I can help you if you come to see me. It's probably good to start about talking about why we get loose skin after weight loss. So as we age and the body changes, we lose things called collagen and elastin. These are probably words you have heard before. They may mean something to you, they may not. In terms of the weight loss patient though, and specifically as we creep up in age, those things decrease. The collagen and elastin help skin bounce back after changes. So if you think about somebody that has a pregnancy, their belly grows and it shrinks back to, at least to some extent. If we're younger and we're not putting as much pressure on things, the amount of bounce back or recoil we get is going to be greater. As age goes on and weight increases more and more, the body's ability to fully recoil is going to be less and less. The other factor with this can be time. So if we lose weight slowly, your body's ability to process that and shrink is generally going to be a little bit better than if we lose weight super quickly. So what I will frequently see, especially in patients that have weight loss surgery, is they lose the weight so quickly, their body's almost like shocked and it can't bounce back as much as possible. So frequently, those are the folks that we see that will actually have hanging skin that really benefit from skin removal surgeries. A question I'll get asked, especially people like in the DMs on Instagram versus people that are already coming in to see me for a consult, is will this skin shrink with diet and exercise? That's a little bit of a nuanced answer, but to some extent, yes, but mainly, unfortunately, no. So the biggest issue here is time. I like to tell people that we really need to give your body the maximum chance for the skin to shrink back on its own so that we can be optimized if you're coming to me for surgery. So if you say, I lost 20 pounds last month and my skin's loose, I'm gonna tell you we need to wait months, if not a year, to see what your body's gonna do to pull that back in. Because I think in this circumstance, the ideal situation is your body takes care of it and you don't even need me. I hate to say that because I love to operate and do surgeries, but sometimes less is more in that aspect. So then people will say, well, my skin didn't do it on its own and I don't want surgery. Is there something intermediate that I can do that's non-surgical to help? And the answer there, of course, is yes, but it's not going to give you exactly surgical results. So a lot of times people will ask me, they'll say, I just have a little bit of loose skin here. What can we do? Usually what will happen then is we will talk about things that you can do in the med spa to help tighten up that skin. My personal favorite is called Morpheus 8. What that is technically, I'm gonna sound really fancy for a second, radio frequency microneedling. At its base though, what it is we numb you up for this of course, is needles are gonna go through the skin and they deliver radio frequency energy that causes an amount of skin retraction. The reason you're getting a little hesitation for me there is it's gonna be different for person A, person B, person C, and you'll really need to talk to either me or my esthetician who's gonna perform the procedure on you to manage your expectations for how much skin retraction you can actually get there. There's other things that we have seen kind of come and go, but personally right now for me, Morpheus 8, if we're not going the surgical route, is the clear winner for that regard. So let's say you've lost the weight, you've given it the time, you know that med spa procedures aren't going to be sufficient to get you the results you want, then we're gonna have to start talking about surgery. Here, really the sky's the limit for what we can do versus, I guess we can say what we should do. So at that point, we're gonna need to have a consultation and I'm gonna talk to you to really determine what your goals are, what our starting point is, and where we want to end up. So obviously people understand that surgery results in scars to some extent, and I am very aware that people don't really love the thought of scars, but then they accept that if they're going to have less skin, that's going to be a part of it. So we're going to talk about the options for you. Now, if we're talking about loose skin on the tummy, we're going to go through all the possible tummy tuck options that are available to you. And we can link below to a previous video I talked about all of those different tummy tuck options. People will also often talk about their arms and then their legs. So obviously arms and legs are two different things, but when I think about doing arm lifts or thigh lifts, they have pretty similar corollaries in the way they can be treated. So I like to think about those as least invasive to most invasive. Least invasive will usually involve some form of liposuction, then with skin tightening in the form of BodyTite. Now, you already heard me talk about Morpheus a little bit ago. BodyTite is a similar technology, but it goes actually under the skin versus Morpheus that goes through the skin, and it's going to give you a better degree of skin tightening than Morpheus can. These are for people that have just the littlest bit of skin laxity that can actually be corrected in this modality. Then if we go to most invasive, if we're talking about arms, that's going to be a scar that goes from your armpit down toward your elbow, or if we're talking about thighs, it goes from your groin down to your knee. Those are people that generally lost more weight, and then they'll like be able to pinch a bunch of skin and be like, this is my problem, I can't stand this. Now, in the intermediate, there's what's called an axillary or armpit lift, and then groin thigh lift. So those are scars that either go just straight across your armpit or straight across the groin. And those are, if we're being honest, most patients are not the best candidates for those, and we'll talk about that. But if you have laxity that's just right by your armpit or right by your groin, those can be a good option without the additional scar burden that goes all the way down either to the elbow or to the knee. Okay, so you've decided that surgery is the way to go. We had our consult. We came up with the best plan to get you to where you want to be afterwards. So then patients still want to know, what can I kind of expect from my scars as time goes on, and what can I expect from recovery as time goes on? So scars are a much longer process than recovery itself. I always tell folks it takes a full year for the scar to fully go through its process. So, right after surgery, it's going to be this perfectly thin little line. A lot of times 2-3 months later, it's kind of expanded a tiny bit and it's red. And if we follow you out a year, 2 years, it generally is going to go back to a very thin, pretty line. Now, if it's not doing that, there's things that we will do in clinic to try and calm it down faster so that you can get the optimal scar appearance. That being said, I'll get some people that are like a couple weeks after surgery kind of freaking out because they'll send me a picture and they'll be like, my scar is terrible. And what they're actually seeing is the skin glue that I put over the incision to protect it while it's healing. That skin glue is purple, so it can look like bruise. And if a little bit of blood seeps under it, it'll turn kind of reddish, darkish color. I tell those folks, we have to be patient. That's not actually your scar. That's just protecting your scar while we're healing in the immediate after surgery process. So we've talked about scars. Let's talk about recovery itself. So I have plenty of videos, breast and tummy, that we can link to below to go through those. Now, if we're talking more specifically about arms and thighs, I'll tell you, most people don't complain too much about a lot of pain after these procedures. That being said, we give you a series of medications that work on different pain receptors so that we're keeping you as comfortable as possible after surgery from a pain perspective. So if we're not going to worry too much about pain because that's going to be under control pretty easily with these couple of procedures. But we do need to worry more about what to expect with what you're seeing. So right after surgery, you're going to be swollen. People kind of feel like they're a sausage in the casing, and everything just is like kind of all puffed out. So that's going to take a few weeks to a few months to go down. But then still, like I talked about for scars, we got to give that skin a full year to kind of shrink back around either your arm or thigh to get our optimal results. So we've gone through your consult. We talked about what to expect kind of in the short term and longer term after surgery. Then people will ask me, how do I maintain this? So again, if we're talking breast and body, I have videos about this, but in this one, One of the things that I'll always tell folks is the best way to maintain your results for long term is to do some of that stuff that your mom told you to do, your primary doctor told you to do, that's maintain a healthy weight and live a general healthy lifestyle. So the biggest killer of surgical results in the long term, for me, in my opinion, is weight fluctuations. Because what's gonna happen is we're gonna stretch the skin, it's gonna try to shrink back, but it never can shrink back as well for that stuff that we talked about at the beginning of the video. And if we go through this cycle, each time it's gonna be a little bit less than its ability to kind of recoil or shrink back. So obviously life is hard. We go through fluctuations. I think in this term, when we're talking like 20 pounds or more, those are the ones that are really gonna kill it. If it's that, 5 to 10 pounds that people bounce between month to month, that's not that big of a deal. So like I said, maintaining healthy weight and then other general healthy lifestyle things are the best way to maintain your results long term. In addition, anywhere we're talking about scars, keeping sunscreen on them is always healthy. If you get a sunburn on that scar early, it's gonna have a tendency to either stay red or turn bright white for the long term, and obviously we would like it to fade as nicely as possible. If you'd like to see more content like this, leave a comment below. Also, don't forget to like and subscribe.